So we got Elon Musk here.
Yeah. He's got some money.
He's got some money.
Yeah, so he's probably had maybe one or two, but that's a good result.
What difference does having money?
It depends in terms of, whether or not how many grafts he's had. That can sometimes be a factor. Again, not necessarily, but sometimes if you're paying cheaper, there is going to be corners cut with the quality, with the equipment used, the aftercare provided. For example, some patients get PRP treatments, plasma treatments, where essentially blood is drawn, it's put into a tube, spun, it's sort of liquid gold, they term it, yeah. Then that's injected. So he might have had that included. He might have had more than one procedure. It does help. I have it. So I have PRP for maintenance. So again, it's about maintenance. So if patients come to me and say, look, I think I need a transplant, I'll say, what do you want to achieve? What's your goal? And if it's just to thicken it up slightly and they've still got some fine hair in that region, try non-surgical measures. Not necessarily just PRP, but, like we touched on before, finasteride, minoxidil. So yeah, PRP works. It works, like with everything. It will work better in some patients than others. But there is some good research out there about PRP.
And how long do you need to be using PRP for it to see the results?
Good question. So with myself, I'm talking about personal experience, right? With myself, I started seeing results roughly 4 to 6 months after the first couple of treatments. So initially, it's good to have 3 treatments over the space of 12 weeks. Then after that, it can vary, depends on how often patients want it. But usually 1 every 6 months is a good sort of starting point after those initial ones.
And so what's that essentially doing? Taking the goodness out of your blood and then putting it into...
pretty much. So the platelet-rich plasma is full of growth factors, nutrients, minerals. So it promotes healing, promotes growth. So in terms of healing, it's using the NHS. A lot of patients don't know this. So the orthopedic teams, for example, use it for patients' knees. So if they've got knackered knees or whatever reason, they will inject it to help promote healing.
Wow.
Dentists use it after implants. So it contains, like I said, growth factors, speeds up healing. With regards to hair loss, it maintains your pre-existing hair. So that fine, thin hair, and it can thicken it up as well.
Wow. Amazing. So you got Elton John here.
Yeah. Again, look, he looks much younger in the right picture. Yeah, that's a decent result as well.
Brilliant. And you got David Beckham. I didn't really know that David Beckham had one.
Yeah, you can tell. Again, you can tell from the outline of the hairline. To be fair, you can see where when it was short, where the sort of grafted hair is. Because as after a transplant, you go through certain stages where it falls out and then it starts to grow again. But yeah, he may have had more than one as well.
And then you got Robbie Williams.
I've not seen Robbie Williams since recently. Yeah.
Looks pretty straight at the front.
Yeah, looks decent. And again, a lot of people will say, is it a good result? It's all relative. I've had some patients, right, who've had absolutely nothing on top. And then they have some hair after, and they're super happy because, they're able to style it, they're able to go to the barbers. So it's all relative. And then you get other patients who feel like they're going to achieve what they had pre-existing hair loss, which is unrealistic. So again, it's not about being a salesman and saying to the patient, you're going to look 15 again. No, it's about being realistic. Obviously, it depends on the area of hair loss. The smaller the area you're covering, the more likely you're going to get better density. You're going to cover a better area. So again, it's all about patient expectation, what the patient wants, and if you can achieve that.
Can you take hair from certain parts of your body, such as your chest area or something like that, and re-put it on your hair?
Yeah.
Will it work?
Basically, yes. In short, you can, right? However, there's a few sort of drawbacks to that. Number one is that the hair will not grow the same. So most studies show that the hair, when it's implanted, say for example, we're talking about chest hair, right? Most chest hair is curly and wavy. I mean, mine is anyway, I trim it, but essentially mine is, right? So if I was to implant that into my scalp, it's going to grow curly and wavy.
Yeah.
Now, some studies show that 70% will stay the same, but 30% may naturalize to the localized environment. So it may start mimicking the local environment.
Wow.
But I've seen some, for example, beard extractions, right? So I can do beard extraction. Recently, I've done a beard extraction where essentially we took hair from the beard from the bottom and placed it into another area in the beard.
Right.
So it's going to hopefully look exactly the same. it's going to be the same type of hair. But I've seen a few patients where they've had a beard extraction and the hair's been implanted onto the scalp.
Yeah.
And if not implanted correctly, you can see the clear demarcation. So you can see where, for example, he had hair taken from the back of his head. It was like the first couple of inches. Then behind that, there was this thick, bushy hair, and it just stood out. But again, there's ways that it should be implanted if that's the route you go down, because some patients do need body hair extraction. So, you know, I don't do it, but some will do hair from the armpits. And believe it or not, I know of some transplant surgeons that will use pubic regions.
Really?
Like, yeah, if and people don't believe that, but if, for example, hair is deplete everywhere else, then, you know, you've got really no choice. And if the patient, again, it's up to the patient, right? If the patient is desperate for some more hair on top of the head, then those are options. So, yeah.
And would you take hair from the back, from the chest, maybe, you know, pubic area? Would you mix it up?
Good question. Exactly. So that's what I was referring to. You know, it's got to be implanted correctly. So firstly, you tend to look at body extraction. When I say body, I'm not talking about this conventional donor area. Other parts like your chest, beard, you tend to look at that usually and as a sort of last-ish resort. So if, for example, someone's already had 1, 2, or 3 surgeries to the back of the head, you've not got much hair left. So then you look at other regions. And that's the thing. You want to, so for the front, ideally, you want to use the hair from the back and the sides.
Because it looks most natural.
Exactly. Because, again, it's all about appearance and front on when people see you most of the time, right? And it is a bit of an illusion. So you want that to look natural. Behind that, for a bit of coverage, yes, you can start spreading the beard and chest hair. Because if you have, you know, beard or chest hair along the front, it won't look the most natural.
So some people would just think of, I'm gonna have a piece of strip cut at the back of my head. That's gonna be stitched up, and then you're gonna then put that in the top of there. It sounds painful.
Yeah.
Has technology advanced further from that?
Yeah, so you're referring to the FUT, so the follicular unit transplant. So that was one of the first methods. So essentially, like you said, they cut like a rectangular piece of tissue out and then take the individual hairs off that, or the grafts, the pieces of tissue with hair on. Then they'll essentially make the incisions and implant. So you are left with, in most cases, quite a big scar. Now, I'm not knocking the FUT because there is some very good surgeons that are able to do the FUT fantastically where you can't see the scar as well.
Wow.
However, most patients want the sort of modern FUE technique where we take individual hair or grafts. We use a special tool to essentially create a tiny little hole around, and then we pull them out using forceps. So that way you're able to spread out the distribution of the ones you take out. So you shouldn't be left with huge scarring. You can never say to patients there'll be absolutely zero scarring, because that can be misleading. Because essentially you are creating a tiny little hole into the back of the head, but it's minimal. So I use a tiny, tiny punch. I probably use one of the smaller ones around in the industry. Some people use bigger ones, which are at a higher risk of scarring. I've started to adopt a smaller one, so it's less noticeable in the donor area. So yeah, the FUT with the big strip cut at the back, they used to term it the smiley face scar, because you used to just see like a sort of smiley face there. But again, look, I'm not knocking it. There's some people that do it very well, but most patients these days want the FUE because they don't want a big scar at the back of the head.
And apart from that technique, is there any other techniques?
Yeah, so there's different variations. So there's something called DHI. I don't know if you've heard of it. It's called direct hair implantation.
Right.
I do that as well. Again, it depends on each scenario.
So what is that one?
So that is similar to the FUE in the first stage, where basically we take out the grafts.
Yeah.
But the second and third stage is different. So essentially what you're doing, you're combining the second and third stage where you're making incisions and implanting in the normal FUE. So what happens in the DHI, say for example, you've got the graft, you load it into a pen.
Yeah.
It's a special implanter device. So what happens is loaded onto the pen, each individual graft. And then what happens is you essentially implant it using that tool into the patient's scalp or whatever region it may be. So essentially you're implanting and making an incision at the same time. There's pros and cons. Like I said, I can do both techniques. I've been doing DHI now as well. So if, for example, particularly in females, they want it unshaven, right? Because they don't want to shave the top of the scalp.
Yeah.
You can do the DHI in a better way, in my opinion, than the conventional FUE. Because if you're making tiny incisions amongst that region, some of their hair is going to get cut naturally because I'm using a blade.